here is your question. Right. So if you have read and understood, considering its surgical anatomy station, what do you think might be the problem with the patient?
This may be parotid tumor,
Very
most
good.
likely malignancy,
Malignancy. Why?
because there is loss of weight and loss of appetite.
All right. And swelling is painful
Yeah. Painful, yes,
and has
and
increased in size.
increase in size
Yes, very
in
good.
2 months only.
Considering what type of tumor do you suspect?
The most common cancer of parotid is
Parotid gland, yes.
dermoid carcinoma.
Okay, good. What else can happen which can involve or which can confirm the malignancy of the parotid gland?
By fine needle aspiration cytology.
Yes, that you can confirm the diagnosis, but there is another clinical feature that confirms or suspects malignancy. Can you guess what that is?
uh,
Involvement of?
of facial nerve
Very good. Yes. What happens when there is involvement of facial nerve palsy or facial nerve?
will occur lower motor neuron facial palsy.
Very good. Okay. Can you also tell me what type of secretions are secreted from the parotid glands?
Serous secretion.
It's most commonly, yes. Okay. Can you tell me what are the structures which traverses parotid gland?
Traverse. Can you repeat?
Traverses. Yes. What are the structures which passes through or traverses parotid gland?
Can I
Structures which
skip this
passes.
question?
Okay. You know the answer. Okay. If I give you a hint, one structure enters the parotid gland and divides in 5 branches. You know that.
Yes.
So
Yes,
can
it's
you?
a facial nerve.
Yes, and its branches. What are those 5 branches?
First, temporal. And
Spread it
the
on your
second,
face and then tell me. Yes, please.
temporal, you put 5 fingers,
Okay.
the thumb into in the temporal area, and
Yes.
this supply the occipitofrontalis,
Yes. If
and
you, yes, we'll come back to that. If you can look at the image in front of you, can you tell me what kind of image this is and what are you looking at?
this angiogram.
No, not angiogram. What is this happening? This is opening where?
This is parotid duct, second
Yes.
molar teeth.
And what is
In
this? What kind of image is this? Xylogram. To see the blockage of the duct. Which duct opens in parotid gland? What's the name of the duct and where does it open?
It's Wharton duct.
Yes, the opening, where exactly it opens?
It's open in the vestibule of the mouth, opposite to the second molar teeth.
Can you tell me the surface anatomy of the parotid duct?
Okay, we can we have 4 points.
Yes.
The first point, it is anterior to the trachea of the ear, as the condyle
Okay.
of the mandible.
Yes.
This is the first point. The second point, in the center of the masseter.
Okay. And
The third point, below and 2 centimeters below the angle of the mandible. And the fourth point is the mastoid bone. And when we join this 4 point, this will give the surface area of parotid gland.
okay, this is the surface marking of the parotid gland, right? My question was, if you can tell us the surface anatomy of the parotid duct. So that is the middle 1/3 of a line, which is drawn
Yes,
between intertracheal notch to the middle of the philtrum, and it opens like by piercing buccinator muscle in the upper second molar tooth. So this is upper second molar tooth. This is first and this is second. That's where it's opening. Anyway, if you can tell me what, if you have to discuss, what are the differential diagnoses of parotid swelling or parotid gland swelling? So what other structures, yes, you'll think of?
Okay, maybe it is infection,
Very good, yes.
such as mumps
Yes, very
and
good.
hepatitis.
Yes,
Maybe it is a large lymph node,
very nice,
and
good.
maybe it is a tumor,
Yes,
benign or malignant,
yes,
and it will be
stone,
stone or
yes,
obstruction by coli.
yes, very good, excellent. Can you tell me what are the structures which are susceptible to injury when you are operating on parotid gland? What structures can be injured?
Facial nerve
Yes, and
and
what happens or what is that syndrome or condition called when there is involvement or injury of the parasympathetic fibers of the
Frey syndrome.
Frey syndrome? Yes. What happens in Frey syndrome?
Frey syndrome, it happens when in surgery you cut
Yes.
the parasympathetic,
Yes.
and when the regeneration of the nerve occur,
Yes.
it's occur by regeneration of sympathetic nerve.
Good.
And this will lead to gustatory sweating.
Very good. Okay, can you tell me what happens or in which conditions do you find submandibular gland swelling? Where exactly submandibular gland swelling will be located?
Will be in below the angle of the mandible.
Yes, very good. And what might be the most common cause of obstruction or the swelling of the submandibular gland?
Obstruction.
Very nice, good. Because of infection or the stone.
Yes.
Right. And what type of secretions are secreted from the submandibular gland?
Mixed or mixed serous.
Very good. Okay. Yes. Anything else you want to tell me?
Mixed serous secretion.
Okay. Where exactly the duct opens of the submandibular gland, and what does it called?
It open in the floor of the mouth.
Yes.
In the frenulum. Beneath
Yes.
to the frenulum.
Yes.
I forget the name. It's
Begins with W. Okay, can you name the nerves which are at risk of injury when you're excising the submandibular gland? 3 nerves I want you to tell me.
okay. First, hypoglossal nerve.
Yes.
And if it is affected, will affect the extrinsic and intrinsic muscle of the mouth. of the tongue, except the platypus, which innervated by vagus nerve.
Okay.
And
Simply, when there is injury of the hypoglossal nerve, so tongue will be deviated on this, deviated to the side on protrusion, right? Second
yes.
nerve,
The second nerve is lingual nerve,
very good,
and it supplies anterior 2/3 of the tongue.
very good,
And if
yes,
the sensation of anterior 2/3 of the tongue, and if it's injured, this sensation
will be lost. And the third nerve, please.
it is a marginal mandibular nerve.
Excellent. Yes, branch of facial nerve. Excellent.
Is a branch of facial nerve, and this
Very good.
supplies motives of facial expression.
Yes,
And if it's injured, this will lead to the patient cannot show his teeth, or
yes,
cannot buckle his lip.
yes, good. Excellent. All right. With this, we'll end because Bella has already gone. Right, good. Thank you.
Thank you.